Our project is titled Mental Health Services for Transgender Clients Responding to Sociopolitical Events and Helpful and Unhelpful Experiences. My name is Megan Wertz and I use she, her pronouns.
My name is Terra Dunn and I also use she, her pronouns. So trans and gender diverse people face life challenges like discrimination, violence, and an increased mental health burden due to these minority stressors. Trans and gender diverse people face challenges seeking mental health care for support in managing these challenges or to medically affirm their gender, including facing invalidations and microaggressions from therapists. In this study, we wanted to understand trans and gender diverse clients' helpful and unhelpful experiences in therapy, as well as how their therapists responded to ongoing sociopolitical events.
For our methods with this study, we recruited across 4 states with 158 total participants, 110 of which reported being in therapy at least 1 month in the study. The process of data collection began with interested participants completing a screener. Once that was all set, participants completed a baseline interview and biomarker collection. Next, we began the online surveys each month for 12 months, assessing these 3 questions. And finally, there was a final interview via Zoom and another in-person biomarker collection. Our monthly questions ask participants about helpful and unhelpful experiences in therapy, and also discussion of current events in sessions, if any. We used Deduce to code the qualitative data and conducted a thematic analysis for the written responses. We saw that participants reported a range of different gender identities, as seen in the table in the poster. The average age of participants in the study was 33, and we also saw most reporting a low income. 69% of participants identified as white, with 31% reporting people of color. We had a range of responses, again, to these 3 main questions of helpful experiences, unhelpful experiences, and discussion of current events. We identified and we categorized these to assess some of the general themes and trends found in the responses as reflected in the poster. Regarding questions of helpful experiences, we were able to break down into 3 general categories. One particularly was general helpful therapeutic responses, included things like validation, space for emotional expression, and changing perception. Identity-related helpful experiences, such as facilitating access to gender affirmation, inquiring about affirming language, and identity-based conversations, and also responses that brought in the context and systems, such as externalizing stigmas, helping to develop agency, and integrating context. Regarding the unhelpful experiences, some things in general were superficial focuses in therapy, therapists being dismissive, and therapy feeling unhelpful or having worse outcomes, in addition to identity-related unhelpful experiences, such as educating the therapist, minimizing gender and gendered experiences, and gatekeeping. And finally, we had participants that identified format and process of therapy as potentially unhelpful, such as limited availability for therapists and telehealth. And in discussions of current events with therapists, for responses that integrated systems and contexts, we saw people reporting things like having sessions that highlighted systems of oppression, therapists staying informed and sharing views. Some negative responses to current events included things like lack of understanding, rupturing responses, and clients having to educate therapists, in addition to some general positive therapeutic responses when discussing some of these topics like empathy, alliance, and help with coping.
So other research has put forth an ethical imperative to include aspects of social justice and highlighting social inequity. Therapeutic experiences in respect to sociopolitical events may be a way to examine social inequity in tandem with politics. Many therapists need to unlearn their own biases that have been internalized about trans and gender diverse people, and limitations in the study include a majority sample of white participants, and no input from therapists about how they conducted their sessions. Thank you.